And welcome back. Heart disease is the leading cause of death for men and women in the U.S. And that's why February is dedicated to raise awareness about the deadly disease. Joining us now is Dr. Devang Desai to tell us a little bit about the importance of heart health and some indicators that you want to look after and make sure that you take care of ASAP. Thank you so much for being with us.
You bet. Thank you for having me.
Yeah, let's start off first. Okay, why is it so important to spread awareness about preventing heart disease? And it is.
Absolutely. 1 in 3 deaths in the U.S. each year are attributable to cardiovascular disease, heart attacks and strokes. And if we can control our risk factors, we can make a real significant difference in those numbers.
So who then is at the greatest risk of developing heart disease, and what are some of the key indicators that you want to watch out for?
You bet. So let's start with the risk factors. I think traditional risk factors are very important to note. Hypertension, smoking, high cholesterol, inactive lifestyle, obesity, diabetes. I think these are risk factors that we generally are aware of, and if we can control those risk factors, we absolutely can reduce our risk of having a heart attack or stroke. As far as the symptoms go, I think people need to be very aware of how they feel and listen to their bodies. So I think most of us are comfortable with symptoms of stroke. You know, if suddenly you feel slurring speech, a loss of movement of one of your limbs, or inability to see out of one of your eyes, I think we're comfortable understanding that. But I think cardiac pain is much more sometimes vague, and it may start off with just some discomfort in the chest or heaviness, tightness, shortness of breath, some jaw pain or radiation into the arm. So traditionally we say symptoms from nose to navel is concerning.
Well, what if somebody has some of these symptoms and they're concerned? What's the next step?
Okay, so if you are having unstable symptoms, symptoms that sort of come on and really aren't getting better, I think the best thing to do is call 911. I think you need to seek medical attention, because if it really is a heart attack, every minute you delay is more damage that you can potentially do to your heart. Or, of course, with stroke, the same thing. However, if you think you're having some symptoms, I think you absolutely need to talk to your physician. And then your physician may send you to a cardiologist, or your physician may send you for a stress test or other things.
Great. And if people would like more information, by the way, St. Mary's is offering up a special for $99 to help do some of that screening. You can, of course, always go to call them online. You can go 770-3806, or of course find them at their website. That's stmarysreno.com. A little bit about the screening there, and you can find more on our website as well. Thank you so much for being with us, Doctor. We appreciate it. Stay with us. We'll be right back.